Hey there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this video, and I apologize for the light and the sound. I wanted to shoot this video for you real quick before Janice and I head off to a business meeting. We're out in California, so I just want to take advantage of the sort of quiet area here in the hotel before we head out to our meeting. One of the most common causes of hip and knee issues in our clients is a loss of hip internal rotation. And essentially, when there's over gripping or contraction and or shortness of the external rotators of the hip. The external rotators of the hip being piriformis, jumellines obturators, as well as quadratus femoris, and also the posterior fibers of glute medius and the superficial fibers of glute max are also powerful hip external rotators. Now what happens is our clients tend to lose the ability to move their pelvis over top their femoral head. So that's sagittal plane motion, so that flexion or extension type motion, as well as transverse plane motion, and especially internal hip rotation. So what happens is our clients will compensate around their low back and or knee, and that's why so many of our clients develop knee and or low back issues, because they lose the ability to move that pelvis over top the femoral head or to create that independent motion of the pelvis relative to the femoral head. So one of the most important assessments we do with our clients, especially these clients that present with hip, knee, and or low back issues, is evaluating for hip internal rotation, especially in the upright position or that closed chain position. We'll also evaluate it passively as the client is lying down, but we want to see how the client moves their pelvis relative to their femoral head. So I'm going to show you two very simple, easy assessments. One with the feet together and one in tandem step, where the forward leg the client will be heel to toe, and they'll rotate towards the forward leg. So I'm going to stand and step away from the camera. So we'll have our client just stand with their feet together. So both feet are together, hands are on the pelvis. They'll rotate to each side and just compare the ease of rotation side to side. How easy is rotation to one side versus rotation to the other side. Take note of the more limited side because you want to pay attention to that. Then we'll have our client go heel to toe. So I'm going to place my right leg forward, the heel in front of the toe of the back leg. Again, hands going upon the pelvis, and now I'll rotate towards just the forward leg, come back to center, see how that feels, and watch the motion, and just kind of look at the quality of the motion as well as the ease of how easy they can maintain their balance and rotate. Then I'll reverse it, left side comes forward, and the heel of my left leg will go against, my left foot will go in front of the toes of my right foot. So heel to toe, and now rotate towards the forward leg. Again, evaluate a few times of rotating towards the forward leg and compare side to side as well as ease. Because what we're looking for is how well our client can rotate that pelvis over top their femoral head through the transverse plane, which is what Gait is all about. The ability to walk and step forward on your forward leg, you have to have the ability to move your pelvis and rotate it around the hip or the femoral head of that forward hip. And when our clients are over gripping or have short external rotators, they'll lose that ability. So one of the most common causes of that loss is when our client is over gripping from that posterior hip. So when they're over clenching and tightening that posterior hip, so the muscles we talked about, posterior fibers of glute medius, superficial fibers of glute maximus, as well as those deeper hip rotators. Now, why do so many clients grip and tighten that posterior hip? One is for stability, and two is because they've been taught to overgrip or over tighten. And most of us have been taught that when we're doing squats or lunges or bending patterns, when we come up out of those patterns, we get taught to come up, squeeze and tighten and go into a posterior tilt. And what this does is it conditions and trains those hip external rotators to tighten, shorten down, and become overactive. And that oftentimes then leads to the inability to actually get eccentric release. We need eccentric release to get our pelvis to move over top of the femoral head. So eccentric release from the glutes as well as with his hip rotators, so we can actually get rotation of the pelvis anteriorly over top the femoral heads. So how do we address this? Number one, do your soft tissue release. We do our manual therapy and trigger point at work, so you already know how to do that as well. Now, the next strategy we use with our clients is really training them to release and let go of those posterior hip rotators. Because if they don't, or they haven't learned how to let go of those posterior hip rotators, they will continually overactivate them, which will limit the motion of the pelvis over top of the femoral head. So teach your client, do the release work, and then teach your clients, educate your clients how to release through their posterior hip complex, so they start to learn how to let those muscles go when they don't need to have them overactivated, especially as that pelvis is rotating either through the sagittal plane, through a squat, lunge, or bending pattern, or through the transverse plane during gait, for example. So when I come back on Friday, part 2 of this series, I'll share with you how we teach and cue our functional movement patterns with this idea of letting go through the posterior hip, so you still get proper activation of your glutes as well as your hip rotators, but without that over gripping and over contraction that ultimately limits your client's internal hip rotation. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Thanks so much for watching. Make it a great day, and I'll see you Friday on Facebook Live. Take care.